po, Mr. Chair, at muli magandang umaga po sa inyo at sa lahat ng ating mga resource persons. I don't actually have a prepared opening statement and handa po akong makinig sa lahat ng ating mga resource persons at makapagtanong ng ilang mga tanong, particular, gaya ng sinabi ng Chair, kung kumusta na po yung pagpapatupad ng Department of Education ng Comprehensive Sexuality Education, ano po yung mabubuting bunga so far, ano yung mga problema, ano yung mga pagkukulang, para kami po dito sa Senado bilang mga legislators na dapat ay nagkukonsulta, nakikinig, ay pwedeng suportahan ng DepEd at ang mga civil society organizations din na nasa mga komunidad, kasama ng mga community youth at lahat ng mga magulang at syempre yung ating mga guro sa mga eskwelahan ay matulungan kung paano isaayos o pagandahin ang dapat pang pagandahin at isaayos. And I will do all this this morning, Mr. Chairman, in that spirit of valuing and preserving yung maraming unities na mayroon na tayo around the table sa nakaraang mga taon na sinusulong natin yung karapatan at kagalingan ng ating mga estudyante at ating mga anak, in the spirit also of sa mga area na hindi pa tayo ganap na nagkakasundo, ay patuloy na pag-usapan ng mga ito para idagdag sana sa mga areas of unity and sa lahat ng mga bagay na ito, yung marami na nating pagkakasundo at yung mga area din na hindi pa tayo nagkakasundo, to engage in all that in the spirit of charity or even love, Mr. Chairman. So, salamat po, Mr. Chairman, at sa lahat po ng ating mga resource persons.
Maraming salamat, Senator Risa. Just to put on record, the title of DO 31 series of 2018 is the Policy Guidelines on the Implementation of the Comprehensive Sexuality Education. And this was promulgated July 13, 2018. And again, put the discussion in proper context, based on our research, I'll flash on this side. In 2013, we have about 142,000 cases of teenage pregnancies just in 2013. Although this is far below the number in 2012, which is about 209,000. So even though the country is progressing in terms of reducing the incidence of teenage pregnancies, we still have about 142,000 cases of teenage pregnancies. And what is quite alarming, actually, are the incidences of HIV in our country. In 2019, we have about 629 cases of HIV cases from children aged 19 and below, youth aged 19 and below. In 2024, it increased to about 1,059 cases. So that's why those two important data points became the rationale for the promulgation of DO 31, which calls for the implementation of a comprehensive sexuality education. So with that, we'll call on the Department of Education, because this will focus on that particular department order. So give us the rationale, the implementation, and of course challenges and ways forward.
Good morning, Mr. Chair, Senator Gatchalian. Good morning, Senator Hontiveros. I'll begin, sir, with your query. What's the legal basis of Department Order 31 when it was issued in 2018? Based on the records, sir, it would appear that Department Order 31 in 2018 was issued to comply with the requirements under the RH law in Section 14, because in Section 14 of RH law, Your Honors, there is a requirement for the Department of Education to formulate a curriculum with respect to the law, Your Honors. And that is why DO 31 was issued. Admittedly, Your Honors, when you read DO 31, there are some references to UNESCO. particularly the definition of comprehensive sexuality education. Your Honors, I have with me the Assistant Secretary for Curriculum, which may assist us, Your Honors, in discussing the rationale of DO 31, and the Undersecretary for Operations, which may assist us in discussing the challenges that we have faced implementing the department order. If with your permission, Your Honors, I refer to first to the Undersecretary for Curriculum and Teaching.
Yes, go ahead, Asek.
Good morning, Mr. Chair. On a curriculum point of view, the curriculum for the Comprehensive Sexuality Education adopt a grade level, age and developmentally appropriate approach that include learning competencies which anticipate biopsychosocial milestones of by about 2 years. The topics include human development, personhood, healthy relationships, sexuality and sexual behaviors, sexual and reproductive health, gender, culture, and human rights. These are integrated in multiple subjects such as MAPE, Araling Panlipunan, Edukasyon sa Pagpapakatao, and Science. Basically, what we did, Mr. Chair, is we mapped all of the competencies in our curriculum, and then we matched it with those that indirectly or directly address the comprehensive sexuality education.
You can continue with your presentation if you wish.
Yes, Mr. Chair. So in this case, we can see the DepEd CSE framework. Again, this was decided on by a series of consultations with experts and specialists in the field, and they came up with this framework where many different facets of the comprehensive sexuality education are really ingrained and incorporated in what is existing in our curriculum. Next slide, please. For integration of the teachings in the curriculum, hold on, Mr. Chair. Let me just. So teachers employ learner-centered, appropriate to deliver the comprehensive sexuality education curriculum, encouraging active participation of the learners, critical thinking, and reflection. So they create safe and inclusive learning environments by allowing them to respect each other and to treat each other even though they're different. You know, they treat each other as fairly as possible. When students feel comfortable asking questions and responding to sensitive topics. So some examples of how CSE concepts are integrated in the different subject areas is, for example, in science, there's a discussion on puberty, reproductive health, and of course, STIs. For MAPE, there are lessons on personal hygiene, sexual health, and responsible decision making. For
Ed
sa ating USEC at mga ASEC din. So, Mr. Chair, in the briefer that DepEd released earlier this month, you reported that 11,079 PTA, PTC, parent representatives from pilot, as the chair was mentioning, pilot and non-pilot regions were trained and oriented on comprehensive sexuality education. So ano po yung breakdown nitong CSE parent orientations? Pwede niyo po bang ibahagi sa komite namin kung ilang eskwelahan ang involved sa bawat rehiyon, pilot regions at saka non-pilot regions, at ilan pong mga guro ang na-train sa CSE as of 2024, last year, Mr. Chair?
Mr. Chair, let me pull out that data.
Madam Chair, while ASIC Engineer is looking for the breakdown of the PTAs trained, based on our data sets, we have been able to train 400,000 teachers on CSE, specifically the more sensitive and more complex aspects of CSP that is separate from their inset or their in-service training.
Tapos may bilang na po ba ng mga parent orientations? Kasi 'di ba dun sa DepEd, yung CSE hindi lamang para sa mga estudyante, para din sa parents and guardians, and of course para sa teachers. So ano naman po yung breakdown ng CSE parent orientations?
I'm trying to locate that data, Mr. Chair.
Thank
My
you, Asik.
apologies. If you can give me more time po.
Yes, certainly, Mr. Chair. At pati po sana kung ilang mga eskwelahan ang involved per region at saka ilang mga guro ang nasanay din sa CSE as of 2024. May I proceed, Mr. Chair? Or salamat po. So, since the issuance of this DepEd Order 31, series of 2018, so going on 7 years na, ano po yung main bottlenecks na nagpabagal dun sa faithful and effective implementation of CSE? At sa bottlenecks na yon, anong measures ang ginawa ng DepEd para tugunan itong mga bottlenecks na ito, Mr. Chair?
Madam Chair, in terms of the implementation of DO 31, of course, the initial challenge should be the familiarity of our teachers when it comes to the content. And this was supplemented by conducting teacher trainings. It was included as part of the in-service training, which covers all teachers as part of their mandatory annual training. But apart from that, we also pushed for the specialized training of CSE oriented teachers, which, as I've mentioned earlier, about 400,000 teachers have been trained on that matter. And our goal is to hopefully eventually get all teachers accustomed to knowing how to effectively handle CSE as a topic for our learners.
So, Mr. Chair, 400,000 specialized teachers. Sa kabuang, ilan po ba ang human resources ng DepEd na eventually may involve sa implementasyon ng CSE?
The universe of teachers that we have, Madam Chair, is a little over 800,000. So we're roughly at around the halfway point, although we would like to note that we prioritized, of course, the specialized training of CSE for the teachers that are handling the older demographics, particularly those handling the adolescent age bracket as intended to by law. And at the same time, we also had a bit of challenge, particularly in terms of coordinating with other government agencies that have pro-adolescent health and well-being services, particularly services that may be offered by the DOH, the SWD, and the like, when it comes to a myriad of reasons on teenage pregnancy prevention, whether it be OSAIC, CSAM, or several other considerations on that matter. More so that in terms of the universe of learners that we're able to monitor, we would only be able to monitor those that are within the school premises. So out of school youth, teenage pregnancies on that regard, we might not be able to provide direct intervention to if they're not part of the basic education system.
Salamat, Mr. Chair. I'd be interested and the committee would be interested, I believe, to hear more ano yung bottleneck sa coordination among other government agencies. And I'm sure, Mr. Chair, maitatanong din po natin during this hearing sa Department of Health. Salamat po dun sa pagbanggit nyo, ASEC, na hindi masaklawan ng DepEd yung buong concerns about online sexual abuse and exploitation of children or OSAIC at saka yung CSAM or child sexual abuse and exploitation materials na nakapagpasa na rin po kami dito sa Senado ng mga batas para ma-empower yung law enforcement agencies, yung community organizations, yung parents sa mga komunidad, pati po yung mga internet service providers, social media platforms, pati financial intermediaries na labanan itong OSAIC at CSAM. And I just want to make it a record, Mr. Chair, importante din ito kahit sa incidents at pagpapababa natin sa incidents ng teenage pregnancy dahil yung vast majority ng mga partners ng mga batang ina natin o yung mga ama ng mga babies ng mga batang ina ay much older than them. So nag-indicate ng power imbalance talaga and the high probability of abuse, even rape of these teenage mothers na ina-exacerbate, fina-facilitate din ng OSAIC at CSAM. And salamat din po, ASIC, sa pagbanggit nyo na syempre ang saklaw lang ng DepEd ay within the school premises. Kaya importante na yung CSE ma-implementa, ma-evaluate, continuously ma-improve, maiayos yung mali, mapuno yung gaps, also for out-of-school youth or community-based youth. At may tulad sa aming mga magulang sa mga eskwelahan and guardians and teachers, ma-empower din yung mga magulang and other responsible adults sa mga komunidad, tulungan yung ating mga out-of-school youth, maiwasan ang teenage pregnancy at kahit mabuntis na sila, manganak na sila, mabigyan ng social protection para magbalik-aral, magtapos, turuan yung paano nila alagaan yung mga babies nila at matulungan sila na maiwasan ang paulit na teenage pregnancy. If I may continue, Mr. Chair. So in our current CSE curriculum, aside from the biological aspects of reproductive health, yung abstinence po ba, hindi ba ito po ay dinidiscuss din bilang isa sa mga paraan na mapigilan ng teenage pregnancy at saka STI prevention? At kung oo, paano din po ito ini-incorporate sa ating curriculum, Mr. Chair?
There's actually no really discussion on abstinence because you don't really talk about sexuality and sex in the curriculum. What we do is we map things. So we talk about these topics as fundamental or basic, science concepts. And even dun sa choice ng mga bata, those are incorporated in other subjects like ESP at saka po sa MAPE, it's not really explicit na talking about, we don't encourage or we don't discourage them from engaging in such acts. So it's really a general, it's part of the curriculum. We just map whatever is in there based on what the Comprehensive Sexuality Education encompasses.
Okay. Although ang understanding ko po, Mr. Chair, sa Comprehensive Sexuality Education na lalo na dun sa binanggit ni ASEC Galban kanina na older demographic, na eventually, pag age appropriate na at pag developmentally appropriate na, lahat ng pamamaraan ng pag-iwas sa teenage pregnancy ay matatalakay. So I'd be curious moving forward how DepEd intends to discuss with the older demographics all the methods including abstinence. And then, just for further sorry po, Mr. Chair, baka si Asik Galban would like to add.
Madam Chair, the rollout of our adherence to the RH law also constitutes not just the curricular component, but also the promotion of adolescent reproductive health services as mandated to by the law. And this focuses primarily on our coordination with other government agencies. So I will provide as engineer the platform to discuss the content, but on the part of the service delivery, our referral mechanism, we focus on presenting basic data sets as to effectiveness of different family planning interventions. So inclusive of that would be your abstinence. Of course, abstinence would have 100% effectiveness vis-a-vis other family planning mechanisms, whether it be your traditional and your modern family planning mechanisms. And these are presented as facts from a health, medical, and clinical perspective. So it provides that platform through the help of our health personnel that are within the Department of Education by coordination with the Department of Health. And this is also why we hope to activate a more effective coordination system, more so, for example, with the DSWD to activate their services on protecting in case that we have learners that become young mothers. They know that there are government services that are there to provide them with assistance. And for those that are affected by abuse, they are knowledgeable as to where to report them effectively within the government system. All of these are part of the adolescent reproductive health services that we provide.
Thank you so much, Mr. Chair, at kay ASEC sa pagbanggit yung in a way yung pagiging progressive nung from legislation natin to jurisprudence to implementation na by the executive. And yung salamat sa pagbanggit nyo sa from abstinence to other traditional and modern family planning methods na kapag age appropriate na and developmentally appropriate na, kasama sa content na natatalakay with the older demographics. And indeed, abstinence of course is 100% effective, and then to varying degrees other traditional methods. And for those youth and students who are already sexually active, then nagiging relevant and helpful yung pagtalakay sa modern family planning methods para makaiwas sa teenage pregnancy. If I may, Mr. Chair, I'd also like to ask DepEd for clarity. Yung CSE program ba ay nagtuturo sa mga bata na kasing bata ng 0 to 4 years old tungkol sa childhood masturbation? O what about anal sex, oral sex? Tinuturo ba iyan sa ating mga eskwelahan, Mr. Chair?
Mr. Di po, cover din natin yan kasi ang mga learners po natin nagsistart at 5 years old sa DepEd. And like we said, all of the competencies that we have under this called Comprehensive Sexuality Education are mapped with existing learning competencies already there in the curriculum.
Salamat po, Mr. Chair. ASEC, malinaw po yun. And huli po, Mr. Chair, para sa DepEd, at this point in time in our hearing, ang RPRH law po ba, yung kumbaga, yung pinagmulan, in a way, no? Pinag-ugatan din ng DepEd Order 31. Ang RPRH law ba, pinipigilan ba tayong mga magulang na magpayo sa ating mga anak o gabayan yung ating mga anak sa mga matters kaugnay ng sexual and reproductive health? Bilang abogado din yung ating good secretary ng DepEd at kayo po, dear resource persons from DepEd, malamang kung hindi man lahat, marami or ilan sa inyo bilang mga magulang din, sa opinion nyo po ba, itinatakwil ba ng CSE ang parental authority natin, Mr. Chair?
Hindi po, malayo po yan sa katotohanan. In fact po, ang CSE ay supplementary. Hindi po siya meant to supplant or override the parental authority of the parents over their children. Kaakibat lang po ito, suporta lang po ito. Madam.
Salamat po, Mr. Chair.
Magandang paglilinaw po yan at pag-affirm no, sa ating mga magulang at guardian at yung tamang ugali din ng ating mga guro kaugnay sa atin. At kaya rin po ako, Mr. Chair, nagsimula sa mga tanong ko sa DepEd tungkol sa mga parent-teacher associations at yung mga PTC, parent representatives, at tungkol sa mga parent orientations. Dahil ang appreciation ko rin po sa DepEd Department Order number 31, series of 2018 at na sinasalamin sa mga sumusunod na executive and legislative initiatives ay nag-e-enhance dun sa primary na educational experience ng ating mga anak sa tahanan at kasama tayong mga magulang. Pero bilang ang mga eskwelahan at mga guro ay partners. And ang inaasahan po natin para din sa out-of-school youth natin, para sa ating mga kabataan at mga responsible adults sa ating mga komunidad. So, na walang pagpipigil, bagkus ay kino-complement. And in fact, dinadagdagan yung capacitation para talakayin nga itong usapin ng Comprehensive Sexuality Education. So, for now, Mr. Chair, those are my initial questions for the DepEd. At maraming salamat po sa resource person sa DepEd. Salamat po, Mr. Chair.
Thank you.